The decision to start a family often comes with the unspoken expectation that pregnancy will happen immediately. When months pass without a positive result, that expectation can transform into a persistent, isolating anxiety. Biological data reveals a different timeline. Only 25% of healthy couples conceive within their first 3 months. For the remaining 75%, natural conception typically requires 6 to 12 months, a standard timeframe that often triggers premature panic. This pressure frequently leads couples to follow generalized advice, such as the assumption that every woman ovulates exactly on day 14 of her cycle, a calculation that ignores the variation in individual biology. Successful conception depends on a precise sequence. Specific hormones must trigger an egg's release, and the internal pathways must be clear for fertilization. You can often improve your odds by focusing on a few specific biological variables. The first variable is identifying your actual fertile window. To do this, we have to look past the standard calendar and calculate based on your body's specific cycle. This timeline shows how to find that window. You subtract 12 to 14 days from the date you expect your next period to begin. This adjustment accounts for the unique length of your cycle, rather than a generic average. Pinpointing this precise moment is absolutely critical because of the strictly limited survival time of these microscopic reproductive cells. The lifespans differ drastically. Sperm survive in the reproductive tract for 4 to 6 days, while an egg is only viable for a strict 48-hour window after release. This means the goal is to have sperm already present before the egg arrives. By understanding these lifespans, you shift from guessing to a strategy based on cellular timing. The second variable involves identifying ovulation in real time by monitoring your basal body temperature, or BBT, your temperature when your body is at complete rest. This graph shows the signature movement of ovulation, a subtle half-degree drop just before release, followed by a sharp half-degree spike that remains elevated. For accuracy, measure your temperature immediately upon waking, remaining motionless before speaking. You can cross-reference this with a second biomarker, cervical mucus. Near ovulation, this fluid shifts from a thick, breakable texture to a clear, stretchy consistency that facilitates the movement of sperm. Monitoring these physical changes provides a direct signal of your peak fertility, replacing general assumptions with data from your own body. The third variable is anatomical. The physical passages and uterine position play a significant role in how easily sperm reach the egg. 20 to 30% of women have a retroverted, backward-tilted uterus. This angle physically forces sperm to swim against gravity. However, simple posture adjustments, like elevating the pelvis with a pillow, uses gravity to create a direct path toward the uterine opening. Identifying these anatomical positions allows you to use basic physics to assist the sperm's path, helping to ensure the uterus is positioned to receive them. The fourth variable is the cellular fuel required to maintain healthy reproductive cells in both partners. Egg and sperm health depend on specific nutrients. CoQ10, vitamin C, zinc, and vitamin D are essential for maintaining the quality of these cells. This is equally important for the male partner. Environmental toxins, smoking, and iron deficiencies directly damage sperm and reduce their motility, their ability to swim effectively. These factors can compromise the DNA integrity of the sperm and their overall cellular concentration, making it much more difficult for a single sperm to successfully reach and fertilize the egg. Conception is a dual responsibility biological system. Neglecting the male partner's cellular health can significantly reduce the probability of a successful pregnancy. When you combine timing, biomarker tracking, anatomical positioning, and cellular health, you move toward an informed strategy for conception. It's important to remember that a delay in getting pregnant is often a normal part of the process, rather than a sign of a medical condition. In many cases, what feels like a failure is actually a matter of misaligned timing, anatomical positioning, or a lack of specific nutrients. You can replace the anxiety of guesswork with the clarity of a biological approach. By identifying these biomarkers and addressing the health of both partners, you can actively manage your path toward pregnancy with a clear understanding of how your body functions.